Hello and welcome to the Multicultural Media Online Conference. This forum is hosted by the Ministry of Health, the New South Wales Multicultural Health Communication Service, and Multicultural New South Wales. Thanks again for joining us. I'm your moderator, Jasusa Halaratna, Deputy Director of the Multicultural Health Communication Service, and we really are so happy that you've joined us today. We're pleased to have back with us Senior Medical Advisor Dr. Jan Feazell today to provide updates on COVID-19 and other public health matters. Also, we're honored to have joining us this afternoon is Dr. S.V. Soundapan. He is a trauma surgeon at the Children's Hospital at Westmead to provide us important information on drowning prevention and water safety for children. He is in between surgery, and we're so pleased that he has joined us and made time to be with us today. I would like to begin by acknowledging the traditional owners and custodians of the land from which we are all meeting from today. I'm joining you from the land of the Darug people. We pay respect to elders past and present and extend that respect to Aboriginal elders and colleagues, and we also want to acknowledge the elders and leaders from all multicultural groups represented at this session this afternoon. We'll do our best to answer your questions today. Please ask your questions and comments on the chat and share your thoughts with us during the sessions. We want to have a lively discussion, so please share your thoughts with us. And thank you as well for always keeping your microphones on mute, as we only have 40 minutes to have Dr. Soundapan and Dr. Jan Feazell to answer your questions. My colleagues from MHCS and the Multicultural Health Communication Service will be adding links on the chat for resources and information available in different languages and health initiatives that are important for your communities. Dr. Jan, hello, how are you? Welcome back.
Well, thank you, Jess, and it's lovely to be back. Good afternoon, everyone. Well, unfortunately, we are still seeing a large number of people with COVID across New South Wales. Many of you will know of family or friends or workmates who are affected at the moment. So it's still important that we keep in mind those little things that can help us stay COVID safe. For all those people who are still getting tested and reporting those tests, we really appreciate that. And we ask you to continue to encourage people who are vulnerable to severe disease to please keep getting tested so that they can get appropriate treatment as early as possible in the course of their disease. We're now seeing evidence that some of those treatments given particularly to vulnerable people can also help prevent long COVID. So it is really important that going into Christmas, New Year, the end of year break, that people have got a very good COVID plan for what happens if they've got COVID, if they're over 50 with 2 or more medical conditions, if they're over 70, or if they're immunosuppressed at any age. It's really important now that we're getting to our end of year parties and we have got COVID going around, that people do what they can to stay safe. So things like wearing a mask on public transport or in taxis or Ubers, making sure that you're up to date with your vaccinations. So if you're over 50, you should have had 4 doses by now. If you're over 30, you've had the option of having that 4th dose. And we'd strongly recommend that if you haven't availed yourself of it, that you do. And again, if you're immunosuppressed, you would have had 3 doses to get your immune system going and then an extra 2 doses after that. If you're catching up with friends, if you've got the choice of being indoors or out, please go outdoors, practice sun safety when you do it, but outdoors is the place to meet. And of course, if you are sick, please stay home. And if you have a sick friend or relative, please do not pressure them to come to the end of year gathering or whatever else. It's really not nice to have somebody else sick because you felt like you had to go somewhere when probably just sending your good wishes would have been enough. So please look after each other, keep each other safe, and have a really good end of year break from those festivities for COVID point of view.
Thank you so much, Dr. Jan. I think that's a really good reminder that to make sure that we're keeping each other safe and not pressuring people to attend events if they didn't feel like going or were not well. Dr. Soundapan, thank you so much for joining us. It's a pleasure to have you, and I know that you're in between surgeries at this time and operations, but thank you for joining us. How important is it for our audiences and the multicultural media and health workers who have joined us today to know about drowning prevention and water safety for children?
Thank you, Jess. Thanks for the introduction, and good afternoon, everyone. I mean, summertime, everybody likes to, be around water. Water sports are very popular in our country. we are particularly concerned this year because the numbers we have seen this year are almost reached what we saw last year, and we're not even into the warmer months. So last year, I think we had across the network, which includes the Westmead Children's Hospital and the Randwick Children's Hospital, we had about 49 children, looked after in the hospital for drowning-related incidents. But this year already we have seen about 47, and the warmer days are just starting, and we want to reiterate to people to be aware of water safety and drowning as a big issue, because this is one area where it's still the number of children coming to the hospitals and the number of deaths from drowning has not changed over at least the last decade in Australia.
Well, thank you so much for that, Dr. Sandap. And a lot of the communities are not aware of how important it is to monitor and supervise their children, and also the restrictions around pools as well, isn't it?
Yeah, that's right. So there are four main things that one needs to be aware of to prevent drowning in children. Drowning is most common in the age group of 0 to 5 in children, and these children have to be closely supervised. So supervision is number one. When you have children under 5 in the water, it's extremely important there is an adult within a hand's reach of these children, because drowning in this age group is silent, unlike an older person who can yell or make noise. Drowning in these children is very silent, and it happens very quickly. Even by the time you turn around to answer a mobile or go to get something, these incidents tend to happen. So that's why it's extremely important you have an adult who is always in charge of looking after children who are in a pool. It's not good to have a youngster around. They get distracted easily, and as I mentioned, this happens very quickly. And drowning can happen in as little as 5 centimeters of water in your bath, or in any water body which contains 5 centimeters. It can happen. The young children have a big head, so once the head goes underwater, then it stays underwater. They can't lift it up. So very important. Supervision is very important. Number 2 is restriction to the swimming pool. So what we know from the data, we collect data quite routinely on this. At least third of the incidents, the children have had access to the gate. The gate has been open, or something has been left close to the gates, so they could actually climb over or open the gates. So make sure there is fencing and gate, and also make sure that your gate is actually working properly, and make sure you don't leave anything close to the gate through which children can climb on. The third thing is awareness, water awareness. So just because a child is attending swimming class doesn't mean they're aware of dangers of water. So it's important to talk to your children about water safety and water awareness. And again, once again, in our data, we know that at least 40% of children involved in drowning incidents actually were attending swimming classes, and still they drowned. And the fourth, and not the least most important one, is resuscitation. So every adult should actually know to resuscitate, and we know that any form of resuscitation is actually better than no resuscitation. Because these children involved in drowning, obviously there's impact on oxygenation, and even if they get better, we do see impact on learning abilities later on, even from very short duration of immersion in water. So immediate CPR or resuscitation of any form is actually very good. So it's important to know resuscitation.
Oh, thank you so much, Dr. Sandap. And just following from what Dr. Jan mentioned, that to encourage people to visit and come together during outdoors. And so if you are going and coming together, and when there's a pool around, then that's important for supervision and just being extra careful. Dr. Jan, in terms of advising parents, I mean, even with the COVID and masks and all that, how are we supposed to prepare parents with what Dr. Sandapan said, and also about COVID and other health issues that's come about, just like a meningococcal has come about too?
Yeah, and I think what we're doing at the moment is we're seeing an increase in meningococcal disease. Meningococcal disease is caused by a bacteria. Whilst we do vaccinate people against meningococcal disease, the strain that we're seeing currently is meningococcal B, for which most of us are not vaccinated against. And the hard part with meningococcal disease is that it has a very, very innocuous onset. It's usually somebody feeling a bit unwell, somebody with a bit of a headache, aches and pains. What gives you the alarm signs is when this disease progresses, the person may be more difficult to awake, children may cry and scream with a very high-pitched cry, people may not like the light, that's called photophobia, and of course people can come up with this very distinguishable rash, which is, it's sort of a purple blotchy bruisey rash that when you press it with a glass, doesn't disappear. So when you push the glass on it, you still see these bruises underneath it. People can also have a headache and also complain of a stiff neck. Now, most people who are unwell, feeling not so great without that rash, probably got something else, because we do have a number of things going around at the moment. But if things do get worse, please do seek urgent medical attention. It is really important. And if that rash comes, that's an absolute medical emergency, and you should get the person to the emergency department as quickly as possible.
Thank you so much, Dr. Jan. And Dr. Sandapan, I think it's also important that for children, would you say that if children are not feeling well, that they shouldn't be going into the pool?
Yes, exactly, absolutely, because then it is more likely to spread to the other children too. So it's if your child is unwell, just as was mentioned now, it's best to keep them away with COVID still running around, and COVID tends to be quite silent in children. So if they're unwell, they should not be mingling with other children.
Thank you so much, Dr. Sandapan, for that. And if you've seen that there are some resources that's coming on the chat, would love for you to ask your questions. We've got two great experts here to answer all your questions for COVID, public health, and also water prevention. Dr. Jan, we talked about how important it is to wear masks and keeping safe. The restrictions, in some countries like Asia, there are a lot of people still wearing masks, and that is really important, especially that there are cases rising in New South Wales.
So I think it's really important that if you are planning to travel, one, make sure that not just your COVID vaccinations are up to date, but all your travel vaccinations are up to date. So talk to your GP or your pharmacist about making sure that your vaccinations and the vaccinations for your family are up to date before you travel. Have a plan for what you'll do if you do get sick while you're overseas, and make sure that your travel insurance will cover any of those costs. And think about very carefully about looking to see if you've got a choice of City A and City B. If you know there's a big outbreak or something's going on in City A, maybe head towards City B, because we often are making those choices, luckily now that we can travel. Of course, the other thing is supporting people who are coming to Australia from overseas. And there's a number of different things, because we haven't had a lot of guests for 2 years or more. So again, it's helping people understand that we do ask people to wear masks, to be polite when there's COVID around, and there is COVID around, why we're meeting outdoors. And particularly for overseas guests, whilst we're talking about drowning, the very different circumstances that water is in Australia compared to overseas, the fact that we have surf, and the surf is quite dangerous if you're not used to it. So making sure that people swim between the flags, and that children are within that arm's reach, but also that if adults who are uncertain, that they don't go out of their depth, they don't try and go too deep. Thinking also about our rivers, and the fact that our rivers are very appealing on a very hot day, but also being really mindful of the fact that the flow in those rivers can be really, really fast. And so if you're not a strong swimmer or you're not confident, it's much safer to try and go to a swimming pool or a swimming area rather than just jump in the first creek or river you see, because it can have unfortunate after effects.
Thank you, Dr. Jan. Dr. Sandapan, did you want to add on to that?
the issue, as rightly mentioned just before, with free water bodies, and particularly with all the rains we've had recently, I'm sure there are lots of water bodies around, and young children or young adults and teenagers are likely to be very adventurous and try to do, some adventurous things in these water bodies. It's important to talk to them again and make them aware of these dangers. With CPR, there is a free resource available for parents, CPR for parents. It's an online thing which everybody can do. There's information on CPR for young children and older children. So it's a free resource for families.
Yes, thank you, Dr. Sandapan. And following up on what Dr. Jan said, a lot of people, although Dr. Sandapan said that those who are learning to swim still can drown and are at risk of drowning. And so what more those who do not have information about swimming. And we've heard that as well with rock fishing and as well, isn't it, Dr. Jan?
And I think it's just one of those things that when we're in a different circumstance to what we're used to, and Australia is a very different country to what people are used to. But the other thing is with all the floods, often things have changed underneath the water. So even if you've got your favourite swimming spot that you have swung on a rope since you were 5 years old and nothing bad has happened to you, at the moment, because so much floodwater has gone through, we know that there are new logs, new trees, new rocks where they weren't before. So please, we just need to be careful this summer because we have had a lot of change in our inland waterways, including some of our lakes and so on, because they've received some of this thing. And of course, if there are still floodwaters circulating where you are, that water can have a lot of feces, agricultural contaminants, all those things, which is why if we do have future floods, staying out of that floodwater as much as possible is so very, very important. It's a huge novelty. I had the misfortune of having, water go through somewhere where I've just recently bought a place to be. And it's just like nothing else, watching, trees float by what would normally be an empty paddock. So it's so important, though, to understand that that tree has to wind up somewhere. And if I just assume it's nowhere else, it could be where I'd normally go swimming.
Yes, thank you, Dr. Jan. And floodwater can make you sick. So like you said, do not play or do not swim if unnecessary. And there are resources available in language that provide that advice in posters. So we can certainly share that when we share this recording. We have a question from Violi Calvert from Radio Tagumpay, Filipino Media. And she's saying and asking, with a high number of cases of COVID still happening, would wearing a mask be required as mandatory in at least public transport and shops like it is mandated now in Singapore? Dr. Jan.
Look, I think we've had a lot of discussions over time about that you don't need to have a public health order in place to make good decisions to protect yourself, your family, and your friends. And I think this is one of those examples where wearing a mask is something that you can do that is a simple intervention that reduces the risk that if you are unwell, if you've got that mask on, you've got something catching a whole lot of the stuff that's coming out of your mouth, those tiny little droplets that we've spoken about. And similarly, if you've got a mask there, it reduces the risk that you're breathing them in from someone else. So wearing that mask when we're on public transport, because we can sit next to someone for 2 or 3 hours, depending on where we live, it's really important to just think about it, because a lot of us will be getting together with elderly people come the end of the year. People will be getting together with people who are immunosuppressed, recovering from cancer. It's really important that we do what we can to protect the people who are vulnerable, and something that we can do that is kind and appropriate is to wear that mask to prevent ourselves getting sick and to try and prevent other people getting sick, because we still have that period of time where we can have COVID. We can spread it, but we won't know it because we don't have the symptoms yet.
Yes, and also Violi just said that she does wear a mask, but others who don't appear, who have a cold in public transport still don't. So I think it's important for us to just possibly, show by example. And if we are doing the right thing, then possibly we can ask others to do the same. Dr. Sandapan, being a trauma surgeon, and you're seeing a lot of cases in emergencies, how important is it for people to just try to follow and do the right thing and learn those important values and habits that we've had in the past 3 years now, I can say.
You know, we have a saying in trauma that nothing it's not an accident. It happens because of a reason. You know, like you have a car accident, you know, if you wear a seatbelt, you're less likely, or the injuries are likely to be less severe than when you're not wearing a seatbelt. So we know things work, and when we do not follow these things, then, you know, obviously the effect is going to be worse than when you follow the right thing to be done. So for what Violi has just mentioned, you know, everybody should just do the right thing. If you're unwell, you wear a mask, so that we're doing the right thing, and not just for ourselves, but for the public in general. With drowning and things, it's the same thing. You know, with parties now happening, Christmas parties, it's likely to happen outdoor near a pool. So it's really, really important. Somebody is put in charge of watching children who are near the water. So any situation, if you do the right thing, even if something, you know, unintended happens, the outcome is likely to be better, you know, or the person is likely to be less severely affected than when the right thing is not done.
Thank you so much, Dr. Tandap, that's really great advice. We'd like to go now to you know, children and safety, as well as other cases that's come up with young people in terms of vapes, and parents are being reminded to take care and keep their children and young children away from vapes, or vaping, as we call it, Dr. Jan.
Look, and I think there's two really important things. First is that we've got a group of young people who overall, over the past several years, young people have stopped smoking. They don't tend to take up smoking, but what's happened in recent times, we had a whole period of time where people stopped smoking, but what we're seeing now, after a period where there was nothing being, you know, inhaled, this increase in young kids, you know, 12 and over, even younger than that at times, getting into vaping. And vaping is using an electronic cigarette or another device. It can look like a USB, it can look like a pen, that can look like just about anything. And unfortunately, even though it's illegal to sell vaping liquid with nicotine in it, a lot of what's imported from overseas does in fact contain nicotine, and at quite high levels. And so once kids start vaping, they can actually wind up getting addicted. And the vapes are not, you know, necessarily nice products. They can have things like antifreeze in it. They can have other stuff in it that breathing in, especially as a young person with developing lungs, there's a good chance that you may do long-term damage. So one of the things that we're really encouraging parents to do, hopefully you can have a bit more time with your family over the school holidays, over the break. It's a really good time to have some of those, you know, what can be quite difficult and challenging conversations about, you know, we've heard about vaping, or you could watch something on telly together and talk about what you're seeing and why this might not be a bad idea. We know that some older adults find vaping useful as a substitute for cigarettes, but for young people, it's not a substitute for cigarettes. And in fact, what we're seeing overseas is people taking up vaping as a young person and then moving on to cigarettes as they get older. So that trend that we had been seeing of smoking declining across all age groups can change. So we're really encouraging parents to have those conversations, or if your young person doesn't like listening to you, finding a trusted person in the family. Sometimes there's a favourite uncle, sometimes there's a favourite auntie, sometimes it's the grandparents. And often now kids are less aware of the impacts of smoking because fortunately so many people who are adults have given it up. And so they don't have the horrible stories as much, you know. So my story growing up was my grandfather had died from lung cancer before I was born. So there was a real strong disincentive within my family for people to smoke because they knew the devastation of losing someone that they loved and cared about happened. Fortunately, a lot of young people have not had that trauma, which I'm really excited about. But we do need to have those open conversations to sort of talk about vaping. The fact that, you know, cigarette companies have invested a lot of money in getting vapes to lots of places, and they wouldn't have done this unless there was a good reason to, which is to have, you know, profitable people for quite some time. So it's really important that we also model good behaviour, so that if we are adults and we do think about vaping as a smoking cessation tool with a prescription from a doctor, that you do actually have that open conversation about why it's different for you compared to a young person, and the fact that you are actually trying to quit, which is also still important. And we've got the Quit line that can provide support in many, many languages. So it's so important that we all work together to minimise, you know, not just vaping, but smoking.
Thank you so much, Dr. Jan. And there's also the shisha as well, where it's also a dangerous in smoking and vaping, and that's available in multiple languages in information for parents. And as you can see on the chat, there are links to those in different languages. Dr. Sandapan, you encounter and meet with a lot of parents, and these are things that you continue to advise people on how to take care of the kids and reminding them to keep their children healthy. And these are difficult conversations.
Yes, what you know, I often say this to families, and when we do press releases, that we do not want to see your child become a number in the statistics. So that often has a strong impact. Most times, I think we think this will not happen to me, but it can happen to anybody. We just need to be aware of that and accept that risk, and do what we can to minimize that. So every opportunity we have when we are talking to families, we try and have conversations, and depending on the age of the child, about safety issues on the type of activities they involve themselves. So like example, you see someone and ask the child, what's your favorite thing to do? They might say, I like being on a bike, and then you talk to them about helmets and things like that. So we use you know, all encounters to see if we can, you know, have some discussion around safety issues. And it's the same with GPs and families. You know, if you're thinking of buying a toy, you know, during Christmas time, there are lots of new toys that come in the market. Fortunately for us, I think the standards are checked, and if the toy is not up to the Australian consumer standard, then it does not come into the market. But you know, you can get lots of things online now, so you have to think about what you're buying, and whether, if you're buying it for an older kid, how can you keep the younger ones safe from that? So for example, you know, you see these magnets, colorful magnets, which are useful for children with some problems, for as a distraction thing with the, you know, ADHD and things. They're supposed to be good for those kids, but it is attractive for a toddler to see these colorful things, and they like to explore everything with their mouth. And if you put more than one magnet, or a magnet and something metallic, and you swallow it, it can cause you know, perforations or holes in your bowel. So this we see at least, you know, a few of this happening every year. So this is where, you know, well, I'm buying something for the older kid. How do I keep my younger ones safe from that? So those kind of things you need to think about and be aware of.
And I think that's the same thing for the toys or things that you use for, you know, talking about what we were saying about pool safety as well, is what you put in the pool as well that could be dangerous for children who are swimming.
Yes, yeah. All the noodles and those things are not necessarily safe. Those are the type of things you should talk to, or it gives you a false sense of security, maybe. So for the younger kids, that's why I think, you know, you, in spite of all those things, you should be around to see what happens.
And Dr. Sandapan, are there any key safety measures that you would remind parents and carers for this summer?
One other thing which we're really passionate about from the Children's Hospital is falls through windows. Most of our multicultural, I'm from, you know, obviously born and brought up in another country. Most of the families who come from Asian continent or from other parts of the world, there's often a strong rail in the window. Whereas come here, we have, you know, insect or bird nets, which are not at all strong. They're not, you know, strong enough to hold a child. And we're not aware of this. And if you leave your window open, then the kids are likely to fall through. And that's another thing which we see in reasonable numbers during the summer period. So there is a legislation that your window, if a window is 2 meters above the ground level, you should not be able to open it for more than 10 centimeters, which is the size of the head of the child. So the head doesn't go through and the child can't fall through. So again, summer, we're likely to leave the windows open. Make sure if it's your own house or if you're living in a rental apartment, which is where it's more likely to happen because the bedrooms are all small, you're likely to have a bed or a furniture near these windows, and the child can reach it. Make sure there is a lock and is actually working properly this summer.
Thank you so much for that advice, Dr. Sandapan. And Dr. Jan, we're trying to advise people for COVID to keep ventilation open when guests are around. This message is so important about keeping doors and windows fairly safe.
And I think it's all about balance, isn't it? It's about thinking about how much space we have, because a lot of us don't have a lot of space and maybe going to the local park. It's about the fact that kids, when they're together, will play, and it's often kids bouncing on beds, and they bounce on beds and out a window. Kids are kids. They just love being together and they love enjoying it. And it's just nothing but a tragedy when something happens. And it really is, particularly for a lot of people, they may have just moved into the house this year, so they may not have thought about it because it hasn't been a particularly hot October, November. So the windows may only just be getting open now. So particularly if you've moved somewhere, if you haven't checked it out, do check out and make sure that if you haven't got a lock, either install one, but in the meantime, think really carefully about making sure that window can't be opened more by a young person, because, kids will also open windows. They will do all sorts of things. Young people, you may have a teenager who's in the room and then they go out and they've had the window open. You wouldn't have been worried at all about the teenager, but you haven't remembered the 3 young cousins who've come over to play in the teenager's room. So it's really important. And also just with the toys, thinking about one of the things we don't have very much anymore is a film canister. It used to be if it could fit into a film canister. You didn't leave that around because kids were more likely to eat it. I'm not sure what we tell parents at the moment now that we don't have film canisters, but that's what it used to be for us.
That's right. It's a different generations, and I think it is important for us to know when we do have young children and as parents, being aware of what's dangerous and what's not in terms of toys and activities. Well, we have run out of time, and it has been a really good discussion. But I'd like to ask Dr. Sandapan, was there any other reminders or anything that you wanted to say as some last words for our audiences from the Multicultural Media Online here today, and also the health workers and the community?
I would also request everyone to stay safe on the roads when you're traveling during the holidays. It is lots of people, and people tend to get impatient because of the large number of vehicles. So stay patient and make sure you have your children appropriately restrained in your cars. Again, that's another thing which tends to happen during the holidays.
Thank you so much, Dr. Sandapan, and I know you've taken the time to join us today, and you're going back to do surgery and save lives. We appreciate your time with us today. And I'd like to pass it on now to Dr. Jan for any last words on COVID safety and other public health messages.
Look, I think it's also worth saying that towards the end of the year, a lot of people are in a reflective mood, and for cultures that celebrate Christmas, we know that there are a lot of people who won't have everyone that they love and care about with them this year. It's been a really tough couple of years, and particularly a lot of older people, so grandparents, great-grandparents will not be with us this year. I think it's really important that we are kind and look out for people who might be lonely, people who'd normally be caring for an elderly person, And if that elderly person's no longer with us, making sure that we make space for them in celebrations and that we're kind to each other. I think it's been a very long 3 years. I think for a lot of us, it started with the bushfires back in 2019. So there are a lot of tired people, a lot of people who are dealing with stress every day. So don't be afraid to reach out. There are a whole lot of mental health services out there, and it is so important just to look out for people. Again, if you would normally see someone at Christmas or end of year celebrations and you haven't seen them so far this year, do reach out and check in on them, because there are a whole lot of people who are still getting over that isolation that COVID had brought with it.
Yes, thank you so much, Dr. Jen. I think that's really important, to reach out to your friends and family, and know if you haven't heard from them in a few weeks or in a few days or in a few months, it's important to reach out, and that's key. So thank you very much, Dr. Jan Feazell, our Senior Medical Advisor from New South Wales Health, and Dr. Sundapan, SB Sundapan, trauma surgeon from the Children's Hospital at Westmead, for joining us today. Dr. Jan and I, together with our teams from the Multicultural Health Communication Service from the Ministry of Health and Multicultural New South Wales, we would like to thank you for joining us every fortnight, before weekly and now fortnightly, for these important online sessions for COVID-19 health and health updates. This is our last Multicultural Media Online Conference for this year, but don't fret, we will be back for more health information and have more health experts join us, like Dr. Sundapan, and more exciting topics to discuss when we come back in February 2023. In the meantime, please let us know if you have any other health topics you would like us to feature for this conference, and any key guests that you'd like us to feature for your communities. The recording of the briefing, it will be available on the New South Wales Multicultural Health Communication Service website, and we'll send you an email shortly with recording and resources. We'd like to thank you for joining us today. And on behalf of the Ministry of Health, New South Wales Multicultural Health Communication Service, and Multicultural New South Wales, we wish you, your teams, families, and communities a safe and happy holiday season. Thank you very much for all your support throughout the year. I'm Jasusa Halaratna, Dr. Jan Feazell, and our teams. Thank you. Take care, stay safe, and we'll see you all in 2023.